So, hello everybody. I hope you can hear me. Very good. Cool. Yeah, I hope you have a good time. So I really enjoyed the summit, the first day and now also the second day. So it's a really big effort here, Nia and the team of the World Health Network do here, and I'm very happy to be able here to speak. A little bit about our efforts in Berlin. So, and I welcome you to this Berlin time afternoon session. So the screen share works out. I just have to get it. We are a collective. Can't hear anything now. Okay. I can't hear anything. That's a problem. One moment. I just set this up. To my headphones. Josef, kannst du was noch sagen? Ganz kurz.
I can hear you, Connor.
Okay, very good. Okay, good. So, welcome to this session from the Zero COVID Space Collective from Berlin. We are a group of people, bunch of people in Berlin that gets to a very practical way in how to deal with the pandemic for our circles. And this picture here, this was sent to me by Hannah at some day. And I think this depicts us very nicely also how we as a group believe we want to somewhat, we need to get resilient, or we need to get towards some progress within the pandemic. So we did experience for quite some time, for about 2 years now, if we want, that we can wait a long time for the government to put certain frameworks in place. We heard a lot about that, what would be the best strategies and so on. But we are as well really desperate to get back to a stable situation, not only as a big society, bigger society, but also as small groups or as friend circles, as collectives. So the way for the government is obviously a very tiring process. And if we act as solely as individuals, we don't have really a big ground to play. So I think what is depicted here also in the transition movement by Rob Hopkins. So this is a comic made on this transition idea from Rob Hopkins. That if we group together as a collective, that's probably a really good idea to counteract what is going to come with the climate problem, but also to counteract situations like outside contamination, so to say. So what we try to do here is a very practical approach, and to align us as groups here in Berlin, supporting different branches of our networks. And what we want to do here is we want to share some of the things that we do and how we try to practically tackle the problem of the pandemic in some examples and snapshots to get to a more stable situation for our circles. The Zero COVID Space, on the one side, is a model or is something that we try to make easy to understand or easy to grasp, and on the other side, it's a collective that we founded. What about this model? zero COVID space. At the beginning of the pandemic, I was kind of desperately thinking about how to make it easy to, what would be the minimum model, so to say, that would be required and that would motivate people to just do things, to just start do protection. And this is somewhat, I want to share with you a little bit on how this can be put very simple, and what I think is an important kind of framework to get to an understanding and to get self-confident, to take it in your own hand, to protect yourself, your flat, your groups, your community spaces, and this can be depicted as follows, to simplify it a lot. So it's very simplified. So what that is to describe you a little bit about how we tackle it. A zero COVID space can only be a space that gives low risk of infection, or ideally no infection at all, if a group decides to take responsibility. And to really align towards one aim. And this aim is to keep infections out, to put, especially in the beginning, put all the energy and all the focus on that. And that's already when the space starts to emerge. And people align together. A very important aspect is that something that we observe in the society a lot is trivialization of the harm of COVID, for example. And this is, so therefore we depict it as, beside this common alignment, we want to take no discussion really if COVID is dangerous, yes or not, or if we have tricks to vaccination only is a possibility, for example, to counteract it. For us, it's clear the virus is dangerous. We don't want this in our space. And we don't want the virus to hide. So we do all the measures that we can do to keep it out. But this is very simply put. And then I'm very happy that Hannah is here today. And she will talk about how one can get to such a situation, that how can groups form towards such a common aim, right? Beside this definition of, let's say, okay, we are a group, we do certain measures, a simple framework can help to set up, based on the abilities or on the resources, a low risk or minimum risk space. And therefore, the main theme is that we try to, or but we not even try to, but we strictly combine all the measures we can do, somehow afford, and we have to strictly combine at least the 3 layers I will show you now to get to a minimal risk space. What are those layers, or how can we depict or make it more understandable? And the easiest way to depict it really is to, what makes a space, beside this vision, this common vision, what makes a space is a boundary. It's a fence. It's this is the space. Somebody wants to enter the space. There are certain aspects to think about, at least. What we practically do, for example, as groups or as collectives here in Berlin, or what we try to support, which works actually very good, is that people change their behavior towards taking it as a very common and normal thing to test once one gets into such space. So using rapid tests, but also using trust to at this stage make clear or try to really make this division between the outside, having the inside with very low likeliness that somebody just comes in and could potentially infect ours inside. Besides boundaries, where we use molecular tests and other measures, it's very, very important and is something that we strictly do, is that in the inside of the space, we are strictly establishing and helping other groups to do this as well, to have aerosol management. So we found quite some companies here in Germany that provide relatively cheap, quite affordable HEPA filter units. And usually there we work with a combination of vents to have sealing vents, for example, and then that for example, get the air up by easy measures, and then filter always with the HEPA units in a sufficient volume so that it's suitable for the room. So at the boundary, we have the inside protections. We will see some examples later on. What was also very important then is to just make it more easy to understand how to self-protect outside, and to make it, to kind of empower the confidence for people that if you use a mask which is feeling really good, you can really protect yourself. So it doesn't mean that you would like to go into really crowded spaces, for example, but this kind of empowerment towards confidence is some other very important aspect. Now, the broad aim of what we want to, of course, achieve, but it's still an utopia, is that, of course, if you have several of those spaces that really care about that really care about protection, of course, those spaces can form circles. So with an outside pandemic, that is always, for those that follow it a lot, very tiring in part. This can make not only safe spaces, but it can finally make networks that are not only low or minimum in the way of protection against the COVID-19, but it's also a network that gives you a rest, that gives you a possibility to relax and to make each other a good time. The big question now that basically made us kind of busy, or that made me busy thinking, really, was okay. And what is practically really a big deal is this common vision. It sounds very easy, but we see in many aspects that it is not. That this is the central problem, to get towards this understanding that we want to protect. We keep it serious. The virus is something harmful, and we are not discussing this anymore. So, but it seems to be, in the beginning, I started with this as a very simple thing, but it seems to be a main problem, because the technology problem to make these layers work, to have masks outside, to have rapid tests to go inside, for example, and to have contrafaction inside with filter units and with ventilation. This is all set. This is the tools that we have. The much bigger problem is to to get groups towards this statement. They can formulate the statement and that they are confident with it and that they put sufficient resources towards it. And beside just undertaking, for example, a pilot project to say, yeah, let's do this, that, and the other action, a very important thing that then follows up is how can you make a collective or a space in times of pandemic resilient, right? So that the social interaction is working out, so that there is, how can you solve conflict, for example? It's another thing that makes us busy. So, with this, I'm very happy to see here Joseph on the first row there. Joseph is biotechnologist. He will speak more in detail about some practical aspects of how we tackle or how we tackled some security for some bigger gatherings. I'm very happy to see there without video Hannah. Really nice that you are here. Are you here, Hannah? Yeah, I see you there. Cool, very cool. And Hannah will speak about this important aspect of how to tackle it to get towards one alignment in terms of vision. And I also see Florian here, and he will speak about the possibility for cultural activities to put our model to cultural activities and how this was done on some practical insights. With this, I would give over to Hannah if you want, and I still take the screen share, I think, and try to moderate in some slide pictures and so on.
But to be clear, every one of us can share a screen, not only one person, right?
So, the question is, do we hear Hannah? Yeah, okay, good. Okay. We need to move her to the top.
Hello.
Now we hear you. Great.
Okay, so hi again. So I'd like to first of all talk about the human factor, which is quite a requirement that physical tools like tests and like rapid tests and masks, and we already have, that this is a requirement that they get used and used correctly. As
Thank you.
The human factor, like, it plays essential role in success of implementing these measures we have, and to wrap up zero COVID space. And as zero COVID space is not only determined by these physical tools and clearly defined boundaries, and not only also to know about scientific findings, it's also a self-created social system in which people interact with each other and ensure the sustainable existence of that system through the impact of the behavior, which is not quite seen very often. So we think that caring about each other is one of the most important tasks to keep these systems healthy and strong in the long term. And so the inner attitude and the self-image has decisive influence And we realized that people lack the resilience to cope with the challenges of the crisis at the moment. And this takes a lot of energy of all of the people around. And yeah, when people become aware that their actions, as they are part of the system, have a significant impact on the others of the system, they take over more responsibility for others. So it is quite important that they realize their role in a social system like a zero COVID space. And we think that it's one of the most important aspects that the people who get into a zero COVID space are motivated intrinsic, so that they don't endanger the system by not using the tools right. So yeah, this is one of the most important things we think everyone should be aware of, and that people inside the safe spaces like a zero COVID space should care about each other more and are aware of each other, so they can give each other energy back, which we all sometimes lose in social interaction outside of something like zero COVID space. As we all know that there are phases in which we can stand exhausting times, like discussions in the working place or with friends, and sometimes there are phases we cannot stand that very well. So we think it's very important that we catch each other and help us to get over those like not so good phases. And so within a zero COVID space, people not only learn how to protect themselves in the outside, like with masks, wearing masks, right, or using tests, but also they learn how to get more resilient and stand against the energy taken situations outside of such a safe space. So we thought about how to secure that awareness and caring about each other can be how we can secure that in a zero COVID space. And as collective, we worked on some guidelines which helped us quite well to clarify how we define ourselves, our goals, our self-image. And so this is it's a very important aspect, that it's not only defined, that not only clear boundaries are defined, so also the behavior inside of the zero COVID space. And our guidelines we defined these aspects, and that helped us to have a stable basis within our association, and that saves a lot of energy at the end of the day. So we don't lose energy with arguments and conflicts with people who don't align with our values. So we first of all defined of how we see our association, and that's an interdisciplinary community based on humanistic values. And also we thought about our motivation and the purpose of our actions, which is determined by responsible, ethical, and inclusive principles. So we also refer to human rights like physical integrity and social participation. And yeah, for us, our purpose is to meet the highest individual protection needs of those involved within a community setting. Yeah, so for us, it's important that we fixed it in the guidelines that every individual within the zero-COVID space makes the necessary and valuable contribution to the shared system by raising awareness and keeping an eye on each other. So also we define who we exclude definitely from a zero-COVID space, which is for some people self-understood, but also good to just talk about it quickly, and so everyone is on the same level. And so for us, it was important to exclude people who endanger the system or could endanger the system, like if they deny or downplay health risks associated with COVID-19. And also we exclude people who associate with extreme right-wing scene or who make inhuman statements. So yeah, that's pretty much it. And these guidelines help us to keep focus on the actions we do, which got pretty much in the last months. We took a lot of action in different areas. So also we had we took part in a little festival, which Florian will talk about more. And so I'd like to hand over to Florian right now, if that's possible, to talk about these actions.
Could please someone take over? I had to restart my computer and I need, I think, 2-3 more minutes to get it all, set it all up. Did you get that?
Yeah. Yeah, since Flo has some trouble with his computer, I will try to share on my screen. Okay, I assume you can see this now. Yeah. Okay. So part of a holistic strategy for infection protection is, of course, testing. Maybe PCR or rapid testing. It's a really important layer in the Swiss cheese model and works as an entry barrier. What Connor said before. So the goal is not let anyone that is infected into your safe space or group you want to protect. And basically, there are two main use cases where we apply testing, namely that is in the prevention of infection So that is in front of an event, or when you go to work. It can be a workspace, workshops, sports that is indoor, or events. Or you have the problem that you had a close contact or a suspected contact with a high-risk person. Maybe your Corona warning app, they are, I believe, in all of Europe available for their respective countries. And when a sign flashes that you had a high-risk contact, then it's advisable to test yourself so that you can be sure that you're not infectious and put everyone in danger. Okay, so comparing antigen tests and PCR tests against each other, we see that the rapid tests, they are cheap, they are really easy to use, but obviously they lack in sensitivity, like we see here. When the person is not infectious but carries the virus, you don't see a reaction. You get a false negative in the test. And only when you're already highly infectious, then the rapid test shows a positive. And it's not comparing that to the PCR. The PCR shows you a positive result when you're not infectious yet. So you have the chance to prevent the chain of transmission, even when infected people are together, or an infected person is in your space. So in spite of limitations, rapid tests are very useful and identify with good confidence when a person is highly infective. So you can single out the super spreaders that pose the biggest risk. And I don't know who knows that. Recently in Germany, they started not paying for these rapid tests anymore. Before we had the burger test, so you could just go into the test center, get tested for free. And now that is not paid anymore by the government. And also, doing events, it's not compulsory to do testing. So basically, they say people that are vaccinated and people that had COVID can enter an event without testing. So this is an example of a rapid testing strategy we applied to an event setting. So we had a trailer, and we had some people working there, and this was a 2G event, means people who had COVID and people who are vaccinated can enter. And it was thanks to Connor, who convinced the owners of this establishment to apply tests as well, even though it was not mandatory by the government. And our goal is to have to get as close to optimum as possible with a lot of layers. And so this is what a workflow can look like in such an environment. I don't go into detail, and if you're interested, I can send you this. And we had some problems there, because we saw that with a decreasing temperature, our tests showed a lot of positives. So in the beginning of the evening, there was maybe 5% positives, which is already very high. But during towards the end of the evening or in the morning, early in the morning, we had very a lot of false, maybe positive tests. We don't know for sure, but you could see the difference. Also, there was a difference between two apps we found. So we checked at this step, we checked the vaccination status of the people, and there is this app called Cough Pass, which you can check it with. But this app is not protecting data of the people who were scanned, and it is still available on your phone. So there's the app called Cough Pass Check that does not store the data, and so these are things we learn on the way. So, and this is the one before was a prevention strategy, so the entry barrier, and this is an example of mitigation. So we had an event that was not the event I was talking about, but another event where there were a lot of infections from what we know. And so Connor proposed to test people who want after the party. So he set up this provisionary little lab for sampling, and people went there and got tested, and then he sent the samples to the lab. I don't know anymore how much Connor went into detail about the connections to the laboratory, but you may be surprised that it is not as hard as you think to get in contact with the laboratory and maybe talk about conditions when you want to make group tests and have a lot of people doing the tests. And another project we worked on was serial testing of vulnerable groups. So this was.
But I'm in Share B now, so it should be.
So specifically, this was a project that Miriam Pham initiated. She was mainly responsible for it, and we helped in that project as well. And the goal was to have gapless PCR monitoring in vulnerable groups, specifically in children here. And she was got in touch with the lab and thought about a workflow that we helped her with. And so the workflow is you get the samples from the lab, you take them home in the nursery or in the daycare. You have the connection, which samples you give to which people. Then they come back and they get sent to the lab, and then the results go to the daycare, and you have there a trusted person who does this. And it's always the case that you need a trust in people and the common goal to make it happen. So you cannot make this happen only with half of the people attending. So you have to get everybody in line, that it is important to protect their children. And like Janina and Connor said, this is already the first barrier. So, and this workflow should follow certain criteria. It should comply with the general data protection regulation, as you might know. The handout testing and collecting should be very easy to comprehend and to carry out. And the workload who does this, who does the testing and the gathering and the release of the samples, it should be as small as possible, so that that the barrier is low for people to participate. And the last criteria was it should be an endpoint PCR and not a pool test. Because a pool test, when you get a positive result, you don't know which one was the one infected or if several people are infected. So everyone has to go into quarantine, and you have to test a second time. And this specific method that the laboratory does is very effective. It can do high throughputs at a low cost, and we help with info, feedback, and documentation, and some practical help on this project. So this is what this workflow document looks like. Just for example, I scroll quickly through it. If you like, give me a call, or I can send it to you. And it's important to know that one size doesn't fit all. So it's very important that you know what your situation is, and you have to mold it and apply what fits to you. So it cannot be transferred to everybody and everybody's needs in a certain situation. It must be molded in a way that it fits everybody. So the bottom line is we are not helpless in this, and we don't have to hide inside either. And we just want to encourage everybody to do this yourself, to try this yourself, and build your own zero COVID spaces. So that's from me. I hope Florian is ready.
Yeah, sort of. I think I got some mic issues. Maybe it's not the quality you deserve, but I do my best. So regarding the time, I think I shorten my talk a little bit. So the members of our group, we all share like a strong connection to the club and dating scene in Berlin, and especially during the second lockdown, which went on for 6 months. It became very clear that spaces of relaxation and let's call it party are crucial for your mental benefit. So we shouldn't give up on that. So we tested for ways how we can secure parties. Like in the beginning, we did like small parties in parks, more or less for our own. Then there's this one of the biggest electronic festivals in Europe, I'd say, Fusion Festival. They already, like last summer, tried to do their annual festival with a test concept, which was like last year quite revolutionary. But regarding the size, I mean, they think about 70,000 guests come there every year. it was clear from the beginning that the authorities wouldn't allow it. So they tried again this year. Again, the big edition of the festival was denied, but then they went for 3 smaller options in the late summer, and they had bought their own PCR testing lab, I think, on which they spent several €100,000, which was a very smart idea regarding the future. So what they did, like every edition of these smaller festivals, I think it was 10,000 guests each. I tried to, sorry for the technical issues there.
That's some strange noises coming from your computer.
Noises, oh, I think this is just the keyboard. So,
What should we see by now?
the fusion map. Sorry for that. So what is like crucial planning this is the separation between the outer and the inner world, like between the virus and the green zone of the festival. I mean, remember, we can turn any space into a green zone as long as we want to. So the concept was like the guests come to the site, to the gate, do their swab, and then after 6 or 8 hours they should get their test result. But what do we do with the guests in the meantime? So they planned, because normally the campground is inside the Fusion Festival, except the family campground, which is outside, just separated by a road. So what they did is that all the 10,000 guests, a way smaller number than usual, would camp on that family campsite. And so during their waiting time, they were allowed to set up their tents there and socialize. What went wrong at the first edition of the 3 smaller festivals was that like these 6-8 hours waiting time until the result were just theory. They had problems, and tests got lost on the way to the lab, and if a test gets lost, this is like the worst thing that can happen, because then you have to find the person again, do the test again, and etc. Then like the working routine wasn't established yet, and another problem was that like when you had your test swab taken, you would get like a wristband with your QR code. And after 6 hours, you would go to an information point, get the barcode checked, and then they would tell you if the test is ready or not. And then people gathered like in hundreds at these information points, trying to get their test results. Of course, like in a high-risk infection zone then. Like for the next edition, 1 week later, Fusion Festival had set up an app where you could check your QR code digitally, so you wouldn't have to go to that information point, which made things way easier. And due to better working routine, you really, like in my case, I had my test result after, I guess, 7 hours. And then you could, there's a bridge over that road that separates the two sites, and then you could enter the green zone and go for your party. Then we were asked, like Zero COVID Spaces, to do the testing for a smaller festival in Bavaria. Back then, that was in July, like 1 week before the state of Bavaria had ended the free PCR testing for all Bavarian civilians. We would have liked to gain from that, but then we had to change plans, and so we installed like a rapid test. No, sorry for that. Every guest was asked to go. I think the time limit was 6 hours. Like the test should be older than 6 hours, and so everybody had to do their official rapid test and bring the paper with the barcode to the festival site. Again, it was crucial to separate the outer virus world, the inner world, the safe zone, the green zone. So what we did, we just checked at the one entrance the test results and the IDs, documented everything, and I think back then, I think 250 guests, and like I think no infections at this party. Then we were asked to do the testing concept for a party at a small club. I think that's right.
I think we need to wrap it up. Minute.
Okay. Sorry for the improvised thing. Conclusion is, I mean, we can really shift any space, including festivals and clubs, to a green zone, if organizers and guests are behind it, and like technique, testing, and material, everything is all there. It just needs time, manpower, and the will, but then we can like gain everything. Yeah, sorry for that. I hand it over back to Hanne.
Thanks, Flo.
So, Cornelius, your
Yes, hey, Anir. Yeah. So we sum up here, and if you want to further discuss things, we could meet in the share C, I think. Otherwise, we could stay here to enjoy the next session.